Hi, this is Stephanie with Healthcare-Edu. We are here at the school now and I am doing the CNA skills. We are in the state of Massachusetts, so definitely check to make sure your state if there are subtle differences, okay? So I have my students here and we are going to do the skill side-lying position, placing the patient on the sideline position, okay? And so prior to every skill, we have washed my hands, so I've already done the hand hygiene. If you don't know how to do that, go back and watch that video that I posted of washing my hands. And so now I'm coming to get my supplies. For putting the patient on the sideline position, I'm gonna assume that the patient has a pillow in the room. A patient usually has the pillow, and I have 3 pillows here. The students are in class right now. We don't have pillowcases on them, but we would have pillows with pillowcases on them, and if not, for the testing you could put a pillowcase on them. So I'm actually gonna go in with 3 pillows. I always go in with my hand sanitizer and gloves because a lot of times in the room I never know if they have them, okay? So I've hand hygiened, I've washed my hands like I mentioned. I'm gonna go in with 3 pillows, my gloves. I'm gonna knock. Knock, knock, knock. Hi, this is Stephanie, your nursing assistant. I'm actually gonna place you in the sideline position, okay? These pillows are going to be in use, so it's all right to put them on the bed. I'm just gonna put these pillows on the side here, okay? Nice and comfortable. I'm going to make sure I close the curtain for privacy. I'm gonna pull the curtain for privacy. I'm going to take care of my bed, put my bed in proper body mechanics. Can I check your 2 identifiers? All right, I've checked my 2 patient identifiers. I haven't touched my patient yet. So I'm gonna raise the bed. How are you feeling today? Oh, good. All right, so I'm gonna raise the bed to my proper height. Okay, so now I'm going to put my gloves on. So I put my gloves on. You just never know. You might go to touch the sheet and find out that the bed is soiled when you turn the patient. You know, what if the patient didn't tell you they urinated or something? So I always put my gloves on. I'm going to drop my side rail. All right, I'm going to turn you onto your side, okay? So how I do that, oh, sorry, I should put these pillows on the bedside table. That's fine. Okay, so what I actually do here is I'm going to bend the knee and roll onto the side. I take care of the side first, the knee, and then go fix the pillow over there. So to bend, to turn a patient appropriately, you bend the knee. You ask to see how much. Can you reach over to that side rail? I have 1 hand on my knee, 1 hand on my shoulder, because I'm never pulling or tugging, and I turn the patient all the way over. Try not to expose them too much, okay? So I'm gonna take a pillow, I'm gonna fold and place on the patient's back, okay? How does that feel? Now, wherever the patient turns, I'm gonna fluff that pillow there so she could comfortably lay her head. I'm now gonna take another pillow. We wanna make sure that the bony prominences are not touching. So what I'm going to do, expose what you need to expose. I'm always going to lift the joint, support the joint. I'm gonna lift, and I'm actually going to go like this. So this leg needs to be rolled because she needs to stay on in the recovery position, the sideline position. So if you can see, the pillow is placed vertically, so the bony prominences, the kneecaps are not touching, her ankles are not touching up against each other, and neither are the heels, okay? So I've taken care of this side. I can cover her here, fix all my linen. And so what I'm going to do, I cannot walk over to the other side without putting up the side rail. So I'm gonna make sure my side rail's up. You always must do that before you go over to the other side, and you don't wanna reach over too much because you wanna maintain proper body mechanics. Now I'm gonna take my final pillow. I'm gonna come over to this side, okay? And this side might take a little bit of maneuvering. Sometimes you have a call bell here. You might put the side rail down just so you can fix everything properly. Again, you're gonna make sure she's not gonna fall. So what I'm actually going to do is this pillow, I'm just gonna raise a little bit. What you do is you turn this pillow slightly so it's comfortable like that. Can I raise? I'm gonna hold her at the wrist, okay? I put this position so she's not lying on her arm. She's kind of in this position. She has the pillow in the back to stay her neck. Are you comfortable?
Yes.
Okay, she has these, no bony prominences are touching. She should not have any friction or shear. No bony prominences are touching on her lower extremity. I'm gonna put my side rail up. Sometimes it takes some maneuvering with the pillow. I'm gonna just because she's in her side, she still needs to be able to call a nurse. Sometimes you might have to give her the call bell like that or fashion it so it saves, but the patient has the call bell. Okay, are you comfortable?
Yes, I am.
Okay, so now I'm gonna do my finishing up steps, which are my indirect skills. Always leave your room nice and neat. So I'm gonna make sure her sheets look good. So the patient has the call bell. I'm gonna hand hygiene. Okay, I wanna make sure for infection control, because I was touching everything, I don't come back and touch all these. So I'm gonna lower the bed. The bed is low. I'm making sure that it's locked. It's locked. Are you comfortable with your head being like this, or do you want to go up a little higher? Okay, the patient's comfortable. She has her call light, and so that's low and locked. And what if there was some item she needed to reach? This position, she might not be able to reach a lot, but because I'm going to remember the patient's on the other side, I'm going to bring the bedside table there. All right, I'm gonna hand hygiene, open my privacy curtain. I'm gonna exit the room, and we are done.